Does fascial manipulation help those who have had hip replacements or have a limited range of motion?
That's a great question. So let me answer the hip replacement one. Do you think anyone gets their hip replaced while having optimal alignment and their mechanics and their fascia just top-notch? No, right? No one ends up with that surgery while everything is going fine. So it's actually extremely important, and we work with this, to come and see, Dr. Rob and Dr. Soar for some regenerative stuff and to realign your fascia so you simply have better success. Yes? Because this is the analogy I use. Imagine going to, taking your car to the mechanic because the alignment of your car was off and you rubbed out a tire. Well, yeah, you're going to want to replace that tire, right? But can you imagine slapping on a new tire, which is the equivalent of a hip replacement, and leaving the alignment like that and walking out the door? Right? So, yes, you want your fascia work, and it's going to also prevent issues that might be caused just from the surgery, from the recovery from the surgery. The other part of the question, Renee, again, sorry?
The rest of it was?
Long-winded.
Oh, what about hip replacement or limited motion?
Limited motion, yes, but did you see that where I caused the fascial restriction wasn't necessarily what restricted the motion in a whole bunch of other spots? So my answer to that is please go to get evaluated properly, because if you release the wrong spot, believe it or not, you might not get any result, or you might get adverse results. So be mindful with that. Fascia is kind of tricky. Don't just release where it's hurting. Could be coming from somewhere else completely, okay?